Hi, my name is Alyssa, and this is my medical SLP resource binder. So in the beginning, I just printed off the PowerPoints from this class because it had lots of useful information that I felt was very important to put in my binder. So that's what those are. Next, I put some information in about tracheostomies. So just some patient education things, how to care for it at home, and then some things we may do in therapy. Next, which is a big portion of what I have in my binder, is dysphagia. So just what is dysphagia? How do we swallow? So this would be good as some caregiver and some patient education for when they come to therapy. So how does dysphagia occur? What are some problems caused by dysphagia? What causes dysphagia? And how we might treat it with speech therapy. And also just what research is being done on it and where they might get some extra help too. So next, still just a fact sheet for patients and families. So basically it just tells you what dysphagia is again, and then some warning signs that you may have some trouble swallowing and you may want to get it checked out further. I liked this because it has this portion down here that they can take this, it was just a 2-page document, to the doctor with them if they feel like they may be experiencing some swallowing issues. So they could, down here in this bottom part, write down some questions they have for their doctor about anything that they're reading in this little packet, or just some general questions that they may have. So next, I printed off a packet about consistency for food and liquids. So this just, so this is what whole food would look like. So normal, so what we're trying to obviously get the patient back to is their normal diet. The next, so this one is cut up. This one is chopped up. And these tables just kind of tell you, breaks down some food groups, shows what is allowed, some things that we should avoid, and then any special notes or anything that is important so the patient can be able to eat these foods safely and efficiently. So this is what ground looks like. So these would be some good visuals for the patient if they're at home and they've been discharged and they're still on a diet modification. This would be some good pictures for them so that their caregiver, when they're preparing their food, they try to get it to look like this as best they can. Obviously, if they're in a SNF or something, or the hospital, you know, they're going to know what the consistency should look like. So this is more for if they're at home and a caregiver is having to fix their food for them. Last is pureed. And then I just put in here liquid consistency, so thin, nectar, honey, and then pudding. This last part that I have is about cognition, and it's quite a bit, but I just put one test for each domain. So like the first one I did attention, and put a test, so the trail making. And then I just put in some activities that we could do with the patients for each domain. The next one I have is executive functioning, so the RIPA-G, medical information, and then again just some activities that would help them with that. Next one I have is memory, and I have the slums. Again, just some activities that they can do. Picture recalling. Next, I have orientation. And lastly, I have visual spatial, and I have the MOCA here. And then again, just some activities that I thought were good and will be easy to just pull out whenever I need them when I am doing a medical placement. And